and FISB, overview of state PREP program requirements, guidance for submission of the post-award state plan, and information will be provided today as it relates to other resources. For the introduction of federal staff participating in today's webinar, we have Debbie Powell, who is the Acting Associate Commissioner for the Administration on Children, Youth, and Families, and the Family and Youth Services Bureau. Again, myself, Labrita White, Program Analyst and also Project Officer for the State PREP Program. Griffin Mulcahy, who is also a Program Specialist within the Family and Youth Services Bureau, and he serves as a backup to me when I am not available or in the office. Sonali Patel is our Senior Policy Analyst here at the Administration on Children, Youth, and Families. Again, congratulations. Purpose of today's call is to provide guidance on the submission and development of the Personal Responsibility Education Program's Post-Award State Plan. Also to address questions that have been posed by grantees regarding the award and post-award state plan submissions. And finally, to provide other additional resource information to you. Again, to reiterate, our PREP federal staff, Debbie Powell, Labrita White, Griffin Mulcahy. We also have a grant specialist that works with the program out of the Office of Grants Management. His name is Nathaniel Morris West. We typically refer to him as Morris. And also we will be at some point in the near future providing you with information on training and technical assistance contractors to support you in the project. At this time, I'm going to turn the presentation over to Debbie Powell. And Debbie will be providing an overview of ACYF and FISB.
Good afternoon, grantees. Hopefully my audio is coming through loud and clear. I am off-site at a runaway and homeless youth meeting, and so I'm using my BlackBerry, so I'm really hoping that you can understand me and I'm coming across clear. I'm sure many of you are already aware of the structure within the Administration for Children and Families, but I just want to go over a little bit so you understand where FISB lies within that structure. Our parent organization is the Health and Human Services, Department of Health and Human Services, and under the Department of Health and Human Services is the Administration for Children and Families. And within the Administration for Children and Families, the Administration on Children, Youth, and Families is an office which houses the Family and Youth Services Bureau and the Children's Bureau, which is the foster welfare system, child welfare system program. FISB has been awarded the opportunity to administer the PREP program. We're very excited about that because we are an agency that promotes the social and economic well-being of children, youth, and families. And with the Bureau of Children's Bureau, we also engage in protective services and shelter for children and youth in at-risk situations, as well as in our RHY program for the sheltering of youth and the adoption for children with special needs. So that's kind of a snapshot of ACYF. Our political leadership for the Administration on Children, Youth, and Families is Commissioner Brian Samuels. He comes to FISB with a wealth of experience in the child welfare system as well as children in at-risk situations. The slide that you have on your screen at this time shows you the breakdown of FISB. And FISB includes the Runaway and Homeless Youth Program and the Mentoring Children Program, which is in the Youth Division. We also house the Family Violence Prevention Services Act program, and we have a research and evaluation arm, and we now have the Teen Pregnancy Prevention Program, which houses not only the PREP program, but also the Title V State Abstinence Program. The slide that you have on your screen now depicts for you our regional offices. We don't have any PREP representation federal representation in the regional offices, but we do have our runaway and homeless youth representation in all 10 regions. The next slide you will see is a breakdown of the regions and which states are in each region. And the Family Youth Services Bureau provides national leadership on youth and family issues. We promote positive outcomes for children. We support a wide range of comprehensive services and collaborations at the local, tribal, state, and national levels. And we manage the State PREP program, State Abstinence program, and the Innovative Strategies portion of the State PREP program, and the Runaway and Homeless Youth, Mentoring Children of Prisoners, and Family Violence Prevention program. That's just the narrative of the diagram that you saw previously. The next slide shows you a breakdown of the dollars that were awarded to FISB for administering the Personal Responsibility Education Program. And you will see that the Teen Pregnancy Prevention Program has 4 arms. 3 of those arms belong to the PREP program, and the 1 arm under the TPP strategy belongs to State Abstinence. We have, as you know, awarded the State PREP program to the persons on this phone and to other states that could not make it. But we also have a $10 million innovative strategy arm of the PREP program, which was awarded with the Office of Adolescent Health. There's also a tribal arm of the PREP dollars, and the PREP Indian set-aside was a 5% set-aside, and it approximates about $3.2 million, and that FOIA should be on the street in approximately 2 months for the tribal grantees. And it was a little bit delayed from the state announcement because the legislation required that we do tribal consultation with tribes and tribal organizations prior to us designing the PREP program for them. So we have completed our national call to the tribal organizations and to the tribes, as well as several in-person visits to different meetings around the country to talk one-on-one and in a meeting setting as well, group setting with tribal organizations and tribal leaders. So that's a snapshot of FISB. That's a snapshot of how the Teen Pregnancy Prevention Program is organized within FISB, and I will now turn it over to Labrita White.
Thank you, Debbie. Now we will continue with a discussion on program requirements. Grantee, and we'll start with grantee expectations. The expectation is that grantees will participate in quarterly calls with the project officer, myself and others here within FISB. However, initially we may look at more regular calls because of the newness of the project, the program, and perhaps have some calls that occur bi-monthly, every 2 months versus the quarterly, but we will keep you abreast of any meetings and provide as ample notification for those meetings as possible. Also, to bring up all issues and challenges with your project officer, to participate in site visits, regional meetings, again, quarterly conference calls or bi-monthly calls, TNCA training and technical assistance calls and trainings, as well as annual conferences. Grantees are expected to submit all reports on time and to use their grant document numbers on all official correspondence. And the grant document number can be found on your notice of grant awards. Preparation milestones, activities that should be occurring now, will include hiring key staff, complete needs assessment, submit post-award state plan, submit curricula for medical accuracy reviews, and we will provide, FISB will provide instructions on how to submit those documents. We do ask that you not submit your medical accuracy related documents and curricula with your post-award state plan, but we will provide additional further instructions on how that information should be forwarded to us. Obtain training for staff in evidence-based models, finalize partnerships with MOUs and sub-awards for the implementation of your projects, as well as submit a list of proposed adaptations. The proposed adaptations may be submitted with your post-award state plan. Okay. Technical assistance. Ongoing technical assistance will be provided by project officers and TNTA partners, contractors, once they are brought on board, through webinars, net conferences, and other medias. Individual and group technical assistance will also be made available.
Rita, can I interject something at this time?
Sure.
This is Debbie Powell, and the technical assistance that you see on this slide is the technical assistance we plan to provide you in the long term once your state plan has been approved. We are now in the process of writing a statement of work and to competitively compete that. However, we are also planning in the very, very near future, in the next couple of weeks, to bring consultants on board in the short term, experts in the field of teen pregnancy prevention. Actually, several organizations will be brought on board. Rita may speak about that later. But just wanted you to know, in case you had questions in your mind about the TA, and if we had any expectation of providing you with TA as you develop your plan. And we've heard you. We try to be very responsive to our grantees. So when we hear there's a need out there for technical assistance or resources, we try to provide that to you. So you will be receiving information from us in the very near future about which organizations have been contracted with to provide you TA in the short term as you develop your post-award state plan.
Thank you, Debbie. As it relates to site visits, periodic site visits will be conducted by federal staff, as well as Debbie has given you some insight as to where we are with securing technical assistance contractors who will also periodically assist or be an extension of the federal government in making site visits as well. The formal agenda will be developed by the project officer for those visits, and we need for grantees to assure the project is in compliance. And the purpose of the visit is for the project officer is to ensure that grantees are in compliance with the terms and conditions and the authorizing legislation. During the site visits, we'll discuss the project's development and observe the project in its implementation phases. As it relates to programmatic, financial, evaluative guidance will be provided in those areas, as well as we will assess any technical assistance needs during those visits. Some of you may inquire about how often visits will occur, because currently we have 46 grantees that were awarded the State PREP grants. We would hope at least to have one visit throughout the 5-year project period, perhaps more, but at present those visits will probably be somewhat sporadic due to the number of grantees that have been awarded. Annual Grantee Conference, 3 staff are required to attend. Funds were and should have been allocated in your budget or will be allocated in your revised budget information that will be submitted with your post-award state plan. The conference will allow an opportunity for grantees to network with other projects, face-to-face time with project officers, learn about new FISB activities, business, learn new strategies and information based on evidence-based findings in the field. And we do anticipate our first conference to occur sometime late summer of 2011. That's an ambitious goal for us, but we are going to definitely try to adhere to that, as the funding opportunity announcement does state that we will host annual grantee conferences. Programmatic interventions are a requirement of the program, of the project. Abstinence and contraception are key to the State PREP program, and there should be significant emphasis in your project proposals, your program narratives that will be submitted shortly as it relates to abstinence and contraception, especially for the prevention of pregnancy and sexually transmitted infections, for the target population. And when we speak of the target population for the state PREP program, we are referencing young people between the ages of 10 and 19 and pregnant and parenting youth under the age of 21. Another requirement is adult preparation subjects. As stated in the funding opportunity announcement, I apologize. As stated in the funding opportunity announcement, 3 out of 6 preparation subjects are required in your program description. And of those, well, there are 6. And again, 3 of those have to be, at a minimum, have to be a part of your program proposal. And those are healthy relationships, adolescent development, financial literacy, parent-child communication, educational and career success, healthy life skills such as goal setting and decision making. Program models should focus on implementing project interventions that most likely demonstrate change in sexual behaviors. And again, the change in sexual behaviors we want to emphasize. Applicants may choose a model or several models from the Appendix A of the PREP FOIA or other models that have been proven effective under rigorous scientific research. Again, with the emphasis on changing behavior, which means delaying sexual activity, increasing condom or contraceptive use for sexually active youth, or reducing pregnancy among youth. Again, that's found in the funding opportunity announcement, as well as on the Office of Adolescent Health's website. But in the FOIA, it's on page 7 through 9, and also it's in Appendix A. Evidence-based and effective programming, again, it's required, and states must replicate or substantially incorporate elements of effective programs that have been proven on the basis of rigorous scientific research to change behavior. We can't say that enough. That's the main emphasis of the project. Again, this slide references those 28 models that are indicated in the FOIA appendix and on the Office of Adolescent Health website within the Office of the Assistant Secretary of Health. Okay. Projects should also indicate if there will be access to health care and other services as appropriate and allowable. Applicants or grantees, now you are in the status of grantees, may provide teenage pregnancy prevention related health care services and or make use of referral arrangements with other providers. Some examples of those types of supports that could be provided through partners are substance abuse, alcohol abuse, tobacco cessation, family planning, mental health issues, intimate partner violence, medical care, other medical or support, financial support services such as Medicaid, S-CHIP, and TANF. Fidelity is key to the project. How well the program is implemented without compromising its core content. This is essential for program effectiveness. Adaptations to program models should be definitely at a minimum. We want to make certain that the integrity, the fidelity of the model or models that have been selected are adhered to in your implementation. There's a definition provided for adaptation, which is also in the funding opportunity announcement. Again, to emphasize, significant adaptations may be needed to address some of the mandatory project requirements, such as adult preparation, abstinence, and contraception, but we are expecting grantees to adhere to not altering to the core components of the evidence-based model.
And this is Debbie Powell, and once again, we have heard from grantees that have asked us, yes, the FOIA did identify very basically what an acceptable adaptation is. And so that's another area that we are providing technical assistance to you. We have a website for teen pregnancy prevention on our Fiscal website. It's under construction, but we do have some of the resources up there for you. And one of those resources is a paper that provides to you adaptations that are considered green, yellow, and red, and those colors pretty much signal exactly what they usually signal. Green is a go, should not affect fidelity. The adaptation should not affect fidelity. Yellow you must be cautious about, and red has definitely been shown to affect the fidelity. So that is just one of the many resources that we have added to our website to help you, and that's one of the reasons that we also will be contracting with TA consultants for you to discuss these types of your types of adaptations that you are looking into, including in your project.
Okay. And what I'll do is go ahead and move on. Thank you, Debbie. That's a great segue for the next few slides that address adaptations. And we have some of that reference material that Debbie spoke of here in the slide presentation, and we will be adding additional information to the website in the very near future that addresses adaptations more completely. And some of that information, unfortunately, we won't be able to add until later in this year or early part of January due to some clearance processes that are required through CDC. CDC, Center for Disease Control, has provided us some great information that we want to definitely pass on to you, the grantees. Okay, moving more into discussion about the adaptation process, we were able to be able to provide to you today some information, preliminary information as it relates to adaptation. And so there are 6 key areas: the determinant matrix, the logic model, the core content, pedagogical and implementation components, the green, yellow, and red light adaptations that Debbie spoke about, as well as fidelity and adaptation monitoring logs and other resources. The matrix would include an analysis, a preliminary analysis that's done by grantees, and maybe some of that work may be in collaboration with a developer of the model around the adaptations that could potentially take place without compromising the core components. Also, the logic model related to behavior determinant interventions. We provided some resource information here for you as it relates to thinking through that process of adaptation. The core components are the essential characteristics of that particular program that actually leads to effectiveness in accomplishing the particular goals of that intervention or that model. And there are 3 categories that grantees should pay particular attention to, and that those are, again, the content, the I'm having a problem here, pedagogical, and the implementation. Tongue's a little twisted. Okay, and we have some definitions and explanations of each of those. And when we look at content, we're looking more specifically at the what is being taught, what information is being shared to change behavior, and the pedagogical components. I don't know why I'm having difficulty with that word today. Is the how the content is taught, and the implementation would be the logistical components of that are responsible for conducive learning environments such as program setting, the facilitator, the youth ratio, and the sequence of sessions. Again, going back to the lights, the red, the green, the yellow, and the red lights that Debbie referenced. And safe refers to green. Cautious is the yellow. And those adaptations that you definitely want to look at avoiding would be in the red zone. Okay, green. Some of the examples of the green light adaptations are update data statistics, change learning activities and instructional methods to youth, culture, development, gender, sexual orientation, to make activities more interactive, customize role plays, and adding debriefing or processing questions. Some examples of the yellow light adaptations would be change of sequence of activities, add activities to reinforce learning, add activities to address additional risk and protective factors, as well as replacing videos or other AV aids. Red light adaptations, those that you should definitely want to avoid, would be shortening the program, reducing or eliminating activities that allow youth to personalize risk, and reduce or eliminate opportunities for skill practice, such as role plays. Fidelity and adaptation monitoring logs are key for looking at the what and the how components of each lesson. Also recording and reflecting on adaptations for each lesson. And finally, core implementation components for the entire curriculum. So those are the areas that some type of documentation should be maintained to ensure, again, that the adaptations do not skew the results of that particular model as far as the outcome and changing and modifying youth behavior as it relates to sexual activity. Another component to the state PREP program that's very key is medical accuracy and age appropriateness. And let me just go back and iterate one point. As it relates to medical accuracy, again, I think I may have said this earlier in the presentation, we will need to review materials, and we will definitely be doing that once we have our TNTA contractors on board to assist in that particular activity. Just anticipate that we will be requesting curriculum and other information related to your project implementation so that those reviews can occur.
But however, the only thing that we need before your funds will be unrestricted is just that certification that your program is medically accurate. So our review of the medical accuracy of your program will not affect your funds being unrestricted.
Correct. Thank you, Debbie. Okay, evaluation strategies, monitoring and reporting on your program implementation and outcomes through performance measures. We will develop performance measures for the project and provide you training and other information sharing related to performance measures by the end of the first year. Federal impact evaluation of a subset of grantees. All states that are selected, and not every state will be selected. It will be a subset of grantees that will be selected to participate in a federal level evaluation as soon as those determinations are made. And we don't anticipate making those decisions until the latter part of the first year, early part of the second year of funding. Performance measures, let's skip one here. Okay. As it relates to your performance measures, just want to reiterate the 5 core areas that we will focus on so that when you're developing your internal measurement devices and logs and tools, you'll be aware. We're looking at output measures, fidelity and adaptation, implementation and capacity building, outcome measures, and community data. In summary, the program requirements, again, just to emphasize those highlighted terms, abstinence and contraception are key. Showing that your program, your project is replicating evidence-based programs and or substantially incorporating elements of effective programs. Definitely submitting a logic model, that your program has some emphasis or focus on informational and support activities, that the project will be geared towards age appropriateness for the target population selected by your state and medically accurate. Definitely that there is fidelity to the model, that your state and those sub-awardees will have the capacity to manage data as it relates to performance measurement, adhering to any evaluation expectations, attending annual meetings, and participating in quarterly, and as I stated earlier, initially bi-monthly calls that will be hosted by Fiscal. At this time, we'll pause if there are any questions. And let's see here. Okay. We're pulling up the questions now. Okay, the first question that we have, the guidance says funds must be used for a program designated to educate adolescents on both abstinence and contraception to prevent pregnancy and STIs, including HIV, AIDS, and at least 3 adulthood preparation subjects among the list of 28 evidence-based programs given in the guidance. Many do not include both abstinence and contraception and adult PrEP subjects. Will ACFSB provide guidance in this area or leave it up to states to put together a combination of programs to comply with this? Actually, at some point, once we have our TNTA contractors on board, we're trying to expedite that process. We will provide to you some support along those areas, but for the sake of answering this question as being cognizant of the fact that your post-award state plans are due to us by February 1st, we do anticipate and expect for grantees to make some attempts to make certain that in the development of your programs and in deciding upon the specific models that you're utilizing, that you cover each of those required areas. Again, we should have TNTA in place fairly soon, but again, it's the anticipation that you're going to do some groundwork in devising ways to ensure that those requirements are met.
And also, that was one of the questions as it relates to adaptation, and that's why it drove our actions to identify experts in the field that can be consultants to you. However, in no way are we saying that these people are telling you what to do. I think we're hiring them for you to use as consultants. So if you want to use one of the 28, if that's your choice versus using some other evidence-based model or practice or strategies, that is up to the state. So if you know that one of the ones that you've chosen does not include some component, at this time we're talking about one of the 3 adult preparation classes, and you have to choose how you're going to adapt to include that. Or you have to choose, if you're going to choose a contraceptive type of model, and you know you need to add abstinence as well because our project is supposed to be comprehensive sex education, then you will have to adapt the model you choose to include the abstinence. And so we're going to have people in the field to help you. However, we still encourage you to reach out to people that are in the field. We have also on our website, or we'll have soon in the next couple of weeks, a list of state organizations. But we have those state organizations already on the website.
Already have a resource list. Yes, that's available.
Great. So we've added to our website already, which is a great thing, resources in every state that has expressed to us that they are working in the areas of TPP. They've either worked with a developer, or they have implemented TPP programs, or they have provided technical assistance for the implementation of TPP programs. So we're providing those lists so you can start reaching out now. But we thought that we wanted to go a little bit further to help you and actually have contractors on the payroll under a contract that you could actually talk to and specifically help you with your adaptation.
Okay. And we have one other question. If we target an age group that isn't included in most of the EBPs listed, An example, older teens. How much flexibility will we have in selecting a program that is not on the list? Okay, we're not requiring, I don't know if I'll fully be able to answer this question, but we're not requiring grantees to use one of the 28. Other programs that have been proven to be effective and have that empirical scientific research to support effectiveness can also be utilized, and there can be a combination of those, utilizing one of the 28 as well as other programs. So that would be my response to that particular question as it relates to the age groups and whether or not you have to utilize one of the EBPs listed. Okay. Thank you for your questions. And we'll proceed by moving into discussion about the post-award state plan. The topic that, yes.
I'm sorry, this is Wendy. Have you received the other questions that were sent through?
I just saw those 2 questions. Let me try looking in another place. Okay, I do see additional questions here. Give us a second to pull these up. And a few more. We want to try to answer as many as we possibly can. Okay. All right. One of the questions is, make the bottom. Okay. Okay. Here we go. Okay. One of the questions is the guidance says. I think we've answered that question. I think we've answered that. Okay. Here's another. State procurement statutes do not allow us to issue solicitations until we can access grant funds. In addition, I'm having a little difficulty. This is, in addition, a solicitation can issue, I think this verbiage is, states cannot issue a solicitation without knowing whether the state plan would be approved, would create additional workload burdens for staff, procurement, and potential sub-awardees. The most we can do is provide a timeline for issuing the solicitation and award of contracts. And that is fine with your, you can submit to us what your timeline, your requirements are for your sub-awardees and what that process will be for actually making those awards. And as much information, specific information about the capacity of those particular sub-awardees in your post-award state plan, and we will give you 30 to 60 days after those plans are submitted. It will not hold up the process for us to review and provide you an approval on your plans, but we do need to have that information, specific information as it relates to sub-awardees, subcontracts that states will be entering with other sub-awardees or sub-grantees. Another question is, if we have sub-grantees, will they be invited to attend the annual conference? Can they be considered one or more of the 3 staff required to attend? And the answer to that question is yes. We will have to set some limitations on the number of participants due to venue, space, and capacity. However, definitely those who are actually implementing the project will be expected and welcome to participate in those meetings. Few of the EBT, another question, few of the EBT contain the adulthood preparation subjects. Are we expected to add these to any EBT that is selected? Because of the requirement in the actual legislation for adult preparation subjects, you will have to make some adaptations to include at least 3 of those adult preparation subjects. Another question, the slide on the annual conference said that 3 staff must attend. In the FOIA it says 1 to 2. Could you clarify so that we can budget appropriately? We'll reference back to that and make certain that our numbers do align with the FOIA, and we'll make certain that that's responded to when we post the frequently asked questions.
Next question is, can we get an electronic copy of the PowerPoint? And yes, that'll be one of the documents that will be posted to the FSBE website next Tuesday. Next question is, do we need to pick one curriculum for the state? Can the sub-grantees choose among the 28? And I believe the answer to that is yes. You can try a mix of the programs depending on what your sub-grantees may want to do. You don't have to implement one evidence-based program throughout your state. Next question is, does our state plan need to list all sub-grantees? I think that somewhat piggybacks on a question from earlier that we understand a lot of states are restricted on being able to procure sub-grantees until after they've received their plan. So if that is the case, we understand that you may be limited, but we just ask that you submit a timeline on how, and you will be procuring those sub-grantees, and then later submit information regarding those sub-grantees once they're established.
Right, the actual grant sub-awardees that are made if you submit that at a later time. In order to avoid adapting curricula, should the adult preparation components be added on at the end of the selected curricula? Not certain that we can respond to that question today. We probably want to consult with others, and we can definitely provide a response to you later in an FAQ frequently asked question FAQ document. Next question, if we are selecting a program from the Tier 1 list, will we need to send in the curriculum for the medical accuracy check? We'll provide additional guidance for you on the medical accuracy review. We're not asking for information to be submitted with your post-award state plan regarding medical accuracy at this time.
Rita, I think they're asking if they choose a Tier 1 program, which all the Tier 1 programs were determined medically accurate because it's one of the 28, will they still have to submit? And yes, the medical certification was a requirement of the PREP. And so even though we understand that those programs may be evidence-based, I don't know if they're medically accurate, but if you're saying if they are, then because we required that documentation, the file must include something with your signature on it to say that, yes, it is medically accurate.
All right, the next question is, will there be regional travel in addition to the required national meetings?
I'll take a stab at that. When putting this board together, we thought through the need to provide technical assistance. And that need is going to be evolving. So it could be, that we decide that one large meeting, national meeting where all the grantees come in to talk and maybe have regional breakout rooms or smaller meeting settings during the national conference. But as this project evolves, and we may hear from the grantees that what would benefit them more is to have regional meetings, our contract that we do write will have the opportunity to have different types of technical assistance. And one of those technical assistance types will be regional meetings and also one-on-one types of TA. So our contract will have the capacity to have different types or different modes of TA provided in different venues.
Next question is, what evidence-based programs work with pregnant and parenting teens or teens infected with HIV? I'm not aware of any programs in the list of 28 to address that.
There are some that do. We can provide a more concrete answer for you with our FAQs, but there are 4 that address STIs, and there are 5 on pregnancy or birth. That's somewhat related to your question, but what we'll do, again, is give you more concrete in the FAQs for the sake of time of the webinar today.
Okay, the next question is, programs that have been found to be promising by the CDC be used? I think the answer is yes. You can use programs outside of the list of 28 as long as they've been found to be evidence-based. How and when will the funds be distributed after FY 2011?
Okay, if states are opting for FY 2011 funding, you can make that information known to us in the submission of your post-award state plan. If you could actually include that in your abstract document, that would be most helpful so that we could see that up front. But also we will have a process for states to submit what's called a letter of intent regarding continued funding throughout the project.
And that'll be addressed later in the webinar.
Right.
And you'll also, if you plan to submit a request for your FY11 funds, Rita will get up to this in a few minutes, but you have to also include your budget for FY11 as well.
Yes.
Next question is, are the exact plan adaptations due for the state plan on February 1?
You need to submit your adaptations list with your post-award state plan. However, if there's some concern about what adaptations are acceptable, and TNTA is needed to support you in your submission of that information. Again, we're going to try to provide that. But to answer your question, yes, we do need to know what your planned adaptations are based upon the models that you've selected to implement.
And that's why you're being given the additional time until February 1st, so you will have time to think through the model you would like to use and the adaptation that you have to make. Because, yes, we do anticipate you submitting to us a complete post-award state plan, which includes the model that you plan to use, the adaptation, as well as the target population.
All right, the next question is, what do you mean by parent-child communication? Were you working with the parents or helping young people communicate with their parents about sexuality?
It could be a combination. Some programs, well, actually, let me back up. I may be confusing all of these different teen pregnancy programs. Let me back up. For State PREP, the target population for services and implementation are young people between the ages of 10 and 19 and those who are pregnant and parenting under the age of 21. So those should be your target. If there are components to your curriculum or to your model that also provide some resources and supports and services to the parents of those young people, that is acceptable.
All right, next question is, may grantees allocate resources for sub-recipients training and the development of data systems to ensure fidelity, monitor implementation, and outcome evaluation? I think the answer to all of that is yes, you can absolutely provide training. We encourage you to provide training for your sub-awardees, then develop systems to monitor the information in your programs to your sub-awardees.
Okay. We have just a couple more, and we'll move on. Don't go too far.
Next question is, can a state issue an RFP this summer, allow each sub-grantee to choose a curricula from a state list and choose which 3 adulthood prep subjects? Therefore, the state could have multiple curricula and adulthood topics. This is kind of a question that's coming before. Yes, you could have a varying curricula and different programs between your different sub-awardees throughout the state. Next question is, do you anticipate the adult preparation subjects to be integrated into the model program or to standalone activities or services?
We anticipate that it's incorporated into the implementation of your project.
All right, next question is, can you share one more time web address with the these slides will be available on November 23rd.
Okay, we'll provide that information near the end of the webinar.
The next question is, the proposal states that we should budget for 1 to 2 key staff. All right, we addressed that earlier. It's a repeat question, and Labrita is going to check and confirm after the webinar. Next question is, may a grantee address more than 3 adult preparation subjects? Again, yes, states can address.
You can address more than 3, but at a minimum, there must be 3 of the 6 addressed in your proposals.
Next question is, if we don't expend all resources during year 1, may grantees request a no-cost extension or carryover?
There is no need for a no-cost extension or carryover. These are state formula grants, and you actually have, with FY10 funding, you have until the end of September, well, the date of September 30th, 2012, to expend your dollars for this particular project, and you can obligate any obligated funding you have until December of 2012 to expend.
And I asked grantees to look at your funding opportunity announcement. We do have extensive language explaining the legislation as it relates to your funding, and you will see that it tells you that each year's funding is available until the second succeeding year. So each year that you get funding, that funding is still available until the second succeeding year. So please take a look at your FOA, and it explains to you how long your funding is available to you each year.
Okay, the next question is asking, is the expectation that the plan will be finalized for the February submission, or is it the understanding that the February submission of the plan is a working document and will be approved upon prior to a final submission?
The expectation is that it is as close to a final draft of a document that your state is able to submit. If there are modifications made or necessary, those modifications will have to be documented and submitted to FISB for approval. However, we do anticipate that the document that you submit on February 1 is a final draft of your project proposal.
All right, we're going to address one more question and then return to the webinar, and then at the end we'll try to address additional questions for those of you who could hang out with us. All right, last question is, may grantees use resources to support the development of a state-level medical accuracy panel?
I don't know that that is necessary, and that FISB will be providing support around that review process. We really want to emphasize that grant funds are used primarily for the implementation of the project. Okay, thank you for your questions. And we'll move on. Let's see. All right, we're looking at the formatting of your state plans, and that's a slide that you should have on your screens at this time. Okay.
Was it your intention to skip ahead to that slide?
No, we're having a little technical issue. We're getting back there now. Here we go.
Slide 47.
Here we go. Okay. All right. In answering the questions, we had some movement on the screen. Required documents. The documents that are required for your post-award state plan are your abstract, which should not exceed 500 words, your transmittal, which is simply a cover letter signed by your authorized representative, and the authorized representative is the person who signed your SF-424 application, and if that person is no longer in the position of authorized rep, we will need a revised SF-424 that states the current authorized rep, and some documentation that speaks to why that change was made. Also, your SF-424 application for federal assistance to note any changes from your abbreviated application that was submitted to us. Your SF-424A, which is your budget information. We also need an itemized budget and budget narrative. The SFP PSL form is your project performance site location document that speaks to where services will be implemented throughout your state. In that some states have not determined or will not have determined their sub-awardees by February 1. We need for you to complete that to the very best of your ability. We do know that some states will have to submit, after the post-award state plan due date, will probably have to submit updated SFP PSLs after those sub-awards have been completed. We also need your table of contents, a program narrative, and appendix or appendices. Okay. The abstract should include project title, service area, name of applicant, the address of the applicant, and let's change that language to the name of the grantee and address of the grantee, the web address of the grantee, the award amount, the project director or primary contact. On your SF-424, you also listed a primary contact person. In some cases, the primary contact is your project director. In others, it is not. If those two roles are different, please list both persons. and what their roles are. We want to know who your project director is, as well as your primary contact, as well as the information that's listed here on how to make contact with them. Also, if you would indicate in your abstract which models you have selected for implementation. And there may be several models if there is a statewide implementation plan, and as well as an overview of the plan. Okay. The post-award state plan narrative should include a goal statement, updated needs statement, target population, program management section that provides a full description, and there are instructions within the funding opportunity announcement that speak specifically to what type of information we're looking for in this and other sections. The program plan and approach, models to be replicated, implementation strategy as well, sub-awardee involvement, and collaborations and stakeholder participation. Criteria for reviewing plans. The post-award state plans will be reviewed in accordance with the criteria as indicated in Section 4 of the Funding Opportunity Announcement. Decisions regarding the approval of the plans with or without the requirement for modifications will be provided to grantees via written notification. Written notification will be provided by FISB indicating, 1, your plan is approved as submitted, or 2, your plan is approved. However, we do need for you to submit additional information for clarity or modifications based on the explanations provided in that notification. Formatting of state plan, a maximum of 90 pages should be submitted, and that includes your appendix. It should be double-spaced. 8.5 by 11 paper should be utilized with 12-inch font. Single-sided, numbered pages, original, and 2 copies of the complete document is to be submitted to FISB. Curriculum to be provided to a TA contractor for medical accuracy assessment after the review of the state plan, which we've already stated. The post-award state plan timeline, FY 2010 grants. The due date is February 1. Plans may be submitted prior to that date, but not after February 1. Federal review period is February 1, 2011 through June 6, 2011. Approval decisions will be made by June 6. Implementation period is based upon the approval decision date that you will receive from FISB and through the end of the second year, which is 9/30/2012. Okay. We're going to skip questions here. We just answered quite a few.
All right, this one we're going to go over the administrative and fiscal requirements for grantees. This is, I chimed in earlier, but this is Griffin Mulcahy. I'm the project specialist, as Labrita mentioned earlier, the contact person if she is unavailable. First, we'll address the role of the program office, which is us here at FISB. Our role is to review applications, state plans, and programmatic reports, additionally respond to programmatic and technical aspects of the grant, ensure that the amounts to be awarded to grantees are consistent with the current statutory requirements, and then monitor all grantee performance. Specifically to the program specialist and project officer, Labrita and I, will be contact for all programmatic issues associated with the grants, review any changes in project scope or budget revisions, review or changes any changes to key staff positions, review the future year's letter of intent and program modifications, and conduct site monitoring, review of the program process and financial reports, and review all programmatic requirements. Then the role of the grants management office is the official signatory for the obligating federal grant funds and all grant business. The office that provides payment information to the Division of Payment Management and Program Support Center. They also ensure the applications comply with applicable business and non-programmatic statutory and regulatory requirements. They monitor all business, financial transactions in the grants for compliance with federal regulations, including interpretation of those federal regulations, and they maintain official grants files for individual grant awards. The grant specialist who we mentioned earlier is Nathaniel Morris, who's who you contact for any negotiating issues and all mandatory and discretionary grant awards, issuance of financial assistance award, notice of award, and terms and condition documents, processing of budget changes, and that assures that both the program office and the grantees fulfill all of the requirements of laws, regulations, and policies. Next slide is a list of the regs and policies that impact the grantees process, and some links to additional resources where you can find explanations for the regs and policies. The next slide is
references our Title 45. Again, another slide that speaks to management of your grant as it relates to the Code of Federal Regulations. Thank you, Griffin. As it relates to reporting requirements, we are requesting that grantees submit quarterly progress reports, not quarterly, I'm sorry, semi-annual progress reports, as well as semi-annual fiscal reports as indicated here. And we have the dates, and we also have additional documents that we'll reference a little later that speaks to the timeline for the submission of those reports. And again, progress reports. They're all due, financial and progress reports are due on the same date. And they are semi-annual. And the performance progress report will include the cover page. We provided a copy of those documents to you in an email, as well as we'll make this document as well as others available to you on the FISB website. We also look at program indicators that are listed here. The yearly continuation of the project, we made mention of letter of intent earlier in the webinar. Letter of intent is required if states are requesting FY11, FY 2012, 2013, and 2014 funding. FISB will provide all grantees with notification prior to the due date of the letter of intent that is to be submitted to us. We'll provide you all of the instructions and information on what needs to be included in that letter of intent. Where the first letter of intent, FISB will be providing notification to states in July of 2011, and then those letters will be due to us from the states by August 30th, 2011. FY 2012 through 2015 funding. If a state does not submit an application in FY 10 or FY 11, and for those of you participating today, this doesn't necessarily apply for FY 10, but it does for FY 2011 funding. The state would then be ineligible to apply for funds for each of the fiscal years FY 12 through FY 2014, as stated in the legislation. Allocations not awarded to states in FY 10 and 11 will be utilized to award discretionary grants to local organizations and entities for the same purpose and in those states that did not make application. Budget revisions need to come to me, and Griffin covered that here, and you will have copies of this information or instructions on how to submit those. All reports, fiscal reports, need to be submitted directly to Nathaniel Morris West, who is your grant specialist, and all of your post-award state plans, progress reports, and also copies of fiscal reports that go to Morris West also need to be submitted to LaBrita White, your program analyst project officer. Billing, I don't think states have issues with billing because you've received typically other federal funding, but this is contact information to the Division of Payment Management if you're having difficulties accessing your funds once those restrictions have been lifted. And again, additional information about the payment management system, which is really mostly tied towards your access of funds, and the payment management system, PMS, is also responsible for keeping a running record of those drawdowns that states make. Grant website resources. We have the OMB circulars that we referenced a little earlier. We also have the Code of Federal Regulations, Division of Payment Management, and link to forms. And the link to forms is key for states that are submitting post-award state plans to make certain that you are submitting to us the most up-to-date forms as you make modifications based on your abbreviated applications that were submitted, again, moving forward with the submission of your post-award state plans that are due February 1. We also have a listing here of other federal teen pregnancy prevention resources. We've mentioned the Office of Adolescent Health, the Center for Disease Control. We have a clearinghouse contractor through FISB. FISB has a website, and there are others listed. And again, this information is not only in the PowerPoint, but we also have it available at this time to you under resources in the FISB website.
And as we said earlier, the actual PowerPoints in the webinar, as well as additional guidance information, will be posted on the website next Tuesday. That guidance will include a document for your budget narrative and budget guidance, a timeline for your reporting, a calendar layout for the entire project period, performance progress report forms, and a document with frequently asked questions that have been submitted, as well as questions from today's webinar. And the additional resources will be the grantee directory, so the various grantees can contact each other, as well as the pregnancy prevention related websites that Labrita just referenced. Here's just an overview of the FISB website and which links to go to find the various information we referenced today. Labrita, I assume, will follow up with an email when that information is posted to the website next week.
And just to emphasize, to the far right, the oval in red, that says this just in, that's where we will post the recording and the PowerPoint from today's webinar. And again, the other emphasis is on the actual grant awards and how to locate grantees. There's a map of the U.S., and you can click on your state and see other FISB grantees in that area that you could perhaps partner with, as well as the oval, the red oval around teen pregnancy prevention, which will take you to a page, and there will be a quadrant. That's the map that I referenced. But here there will also be a quadrant, the first quadrant that states State Personal Responsibility Education Program, and we will add a link for guidance documents for the frequently asked questions and other documents that Griffin just reviewed with you, but already listed there are the current awardees and the grantee directory. If you look to the far right bottom quadrant here, it says Teen Pregnancy Prevention General Information. We have those resources that Debbie mentioned earlier that are already located there for your perusal as it relates to potential contacts to assist you in completing your post-award state plan.
The next couple slides are just to look into the guidance documents that will be posted next week, the project calendar, the reporting timeline, which will state all the dates in each year, so you'll be expected to make your semi-annual progress reports, the budget documents, which is a good overview of how to lay out your narrative and the spreadsheets for your budget, and then the performance progress reports we referenced we'll be submitting semi-annually. Then the webinar FAQs, which we'll be compiling based on your questions we received today.
As well as previous questions that have been asked over the past few weeks, we've also compiled those questions and responses for you.
And then finally, the grantee directory, as you already saw, is available if you would like to contact other grantees in the program.
I'm going to go back to this slide, and hopefully we know we've detained you beyond the set time for the webinar. We appreciate your hanging in here with us. There's a lot to cover in a short period. But we want to go back to this particular slide because Debbie pointed out to me that we needed to clarify a couple of the FAQs, the responses that we provided to you. And also I just want to make you aware, even though you've seen the FAQs, the final copy with the most updated responses will be available to you next week on the FISB website. But just to reference question number 4, it was a question about can funds be used to support a statewide teen pregnancy coalition if one does not currently exist? I gave a response that reflects back to the requirement of the funding opportunity announcement announcement which says funds for the State PREP Grant Award must be utilized for states to support personal responsibility education programs. That's the implementation of programs. So the answer to that is no. I left off the no, but I gave you a really good filter for what we're expecting states to do with the federal dollars. And there's also, I'm going to ask Debbie if she can help with the response here. Question number 12 has to do with, let me just read it to you, a question about PREP funds. I know we cannot draw down funds until our state plan is accepted or approved. My question is, will funds be retroactive to October 1, 2010? The actual expenditures that are acceptable prior to the release of the restriction will be any expenses related to your development and submission of your abbreviated application and your post-award state plan. So I just want to clarify that, and we'll add additional language that speaks to that. Did you want to add anything there, Debbie?
Just to give a clarification about that August 2nd date. That August 2nd date is the date reflected in the letter you should have received with your award from the Office of Grants Management. And it was also in the FOA, and it said that, August 2nd would be the date that, states would be eligible to incur costs. And so I want to explain the background on that. When there's a state mandatory grant program, which is quite different from discretionary, where we do not pay for the applicants to write their application. In the state mandatory grant program, that is an allowable cost that we, the federal government, reimburse you for any of the costs incurred for applying for these mandatory state funds. So we include that date of August 2nd because the FOA hit the street on July 30th. So it could be very appropriate that you might have started getting ready to submit your application as early as that next business day. I think it was August 1st or August 2nd. I think we issued on a Friday, and the next business day was that Monday, which is August 2nd. So that's what we wanted to clarify, is that under a mandatory state program, states are eligible to receive any cost incurred related to submitting an application for funding.
Thank you, Debbie. Okay, and we will add some additional clarity before these questions and responses are posted on next Tuesday. All right. And just, again, to reiterate, there are other resources available, and the websites are provided here for the FISB internet site, okay, and how you can also access the guidance documents that we just reviewed. Just a reminder, when you're submitting your post-award state plans, be sure to include the name of the grantee, your state agency name that's submitting the application, as well as your grant document number, which you'll find on your Notice of Grant Award. We just checked. There were no additional questions and answers. Again, thank you for hanging in with us. We had approximately 50 participants that joined in. We have 46 grantees. We definitely look forward to working with you. If you have other questions, feel free to continue to send emails, make phone calls to us, and we will do our very best to respond to you in a timely fashion as possible. Again, thank you for your participation, and have a great evening.